Do you have neck or back pain and been told you have degeneration and yet you still hurt? Do you wonder about this diagnosis and wonder why you're not getting better? More importantly, are you wondering, how long does it take to get fixed? Don't worry, you're not alone. A lot of patients have these questions. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, fellowship trained in primary spine care, and I've been managing degenerative spine conditions in my patients for several decades now. The information I'm about to share with you is for educational and informational purposes only. It is not a substitute for a complete and thorough examination for medical or chiropractic advice, for diagnosis, or for treatment. These videos are for informational and educational purposes only. So let's discuss how long it takes to get better once you have degeneration in and around your spine. The long and short answer is, it varies. There is not one size fits all that applies to every patient. It has a lot to do with your anatomy. It has a lot to do with the level of degeneration. It has a lot to do with the severity of the degeneration. It has a lot to do with your lifestyle factors, a lot to do with your age. There's a lot of factors that go into it. But there are a few key things that we understand from degeneration. Once a spine shows wear and tear, and please go back and watch some of the other videos that I recorded in this 4-part series. Once a spine that has degeneration becomes symptomatic, the likelihood of it making a full recovery without any symptoms becomes lower and lower the more severe the pain is. In fact, research shows that patients with degenerative spine conditions can sometimes be broken into several different categories. There are some that have mild and intermittent symptoms. There's others that have more moderate symptoms. Then there's some that have what's called baseline, low-grade chronic pain, and the pain levels will spike. They'll ebb, they'll flow, they'll have good days, they'll have bad days. So it really varies from person to person and even region to region in their body. So rather than asking yourself the question, what's it going to take to quote unquote fix this problem? The reality is, with mechanical spine pain, and mechanical means the moving parts that are just painful in the body, the reality is this pain really should be managed. So there's so many other conditions in the human body, such as diabetes or kidney disease, that really requires management. We don't really look for a cure simply because we haven't found one in the world of science and in the world of clinical treatment. And the same holds true for spine pain. Unfortunately, for some patients with moderate to severe spine pain, getting 50% relief of symptoms with chiropractic and conservative care management is considered to be an outstanding recovery milestone. That doesn't seem like a lot unless you're the person that's suffering with chronic spine pain. So the expectations need to be matched, and it varies from person to person. If you're doing something right now and you're not improving, yeah, you might want to consider looking at alternatives. No two doctors are the same, and sometimes a different set of eyes can help you out. So to bring this full circle, rather than focusing on trying to be fixed and asking yourself that question, it's more important to ask, am I involved in effective management? Is there something else out there that could make me feel better longer, give me more function, and help me do more and more things around the house? A lot of different therapies exist to help patients with degenerative spine pain. Anti-inflammatory, activity restrictions, different therapy exercises, different hands-on treatment, all these different things. So having a second opinion is advisable. If you have any questions about this, don't hesitate to contact our clinic. If you or anybody you know is suffering or struggling with chronic pain from a diagnosis being given of degenerative spine disease, we'd be more than happy to give that person or you a second look and take a look at the treatment plan and see if there's something that's being missed. You have a lot of different videos to pick from. I'm honored that you picked this one. I hope to help as many people as I can with this condition. And if you are one of them, we look forward to helping you. But until we meet again, be blessed.